in this country, when people have a lot of pain, especially at that age, you know what we do here. Get on birth control pill, take painkiller. Is that a good thing? Absolutely, in the sense to manage the pain. Is that a good thing for the disease? No.
I wanted to, before we launched into fertility and the heavy subject of baby making, because it's, I tried to put a light spin on what's going on, but we both know that it's a challenging health issue that we're facing. But I want to back up because you and your family brought acupuncture here to the States, as far as my understanding, at least on the local level here in Los Angeles. And I'd really love to know, how did you do that?
Well, my father, Master Ni, now he calls himself Omni. He has been here since 1977. And at that time, acupuncture was just becoming close to legalized. It wasn't even legalized yet. I think it's about 78, 79. It got legalized in the state of California. He came to the States by the invitation of a group of students wanting him to teach Taoist philosophy, meditation, as well as the art of healing in Chinese medicine. So he came to this country first. We were back in Taiwan, and he found this place wonderful and a lot of wonderful patients and people. And then he brought our family here about 1978. And the rest is history. And we were able to study with them also at the same time. Went to local university as well as went to China, did our residency, and continue his mission of helping people through traditional Chinese medicine and Taoist healing. And it basically, my father is more of a general medicine to start with, and he's very good in very unique, difficult cases. And my brother and I, we started as a general medicine practitioner, and slowly we kind of go to different areas of needs. In the very beginning, there was a few fertility patients that seek me out, and I was able to help them and became successful. So a lot of these patients were grateful, and they refer patients to me. So gradually, our practice built from that point. Working with my father, it was a wonderful experience, and slowly as Dr. Ma, my brother, my partner, and I started to venture into our own specialties. And this is where I focused on women's health, and while he focused in more internal medicine areas and oncology areas. So it was a very wonderful kind of complementary kind of work where both of us, even though we're still working with a lot of general medicine, but I really start to focus a lot on reproductive medicine areas, especially at the very beginning. There's areas of endometriosis, a lot of fibroid patients, and then gradually get into the area of trying to help people to get pregnant. So that's kind of like the beginning start.
Mm-hmm. Right. That was the beginning for here in Los Angeles, this idea of healing and energy, and you two having to open the school to help educate other students, or to educate the students and educate your patients. And this idea of energy, I would imagine, was maybe not understood or not well received, or was it met with some resistance in the 80s?
Not really. I think the resistance is never from the patients. I think the resistance is more from physicians at the very beginning. Mm-hmm. In fact, there is a Pacific Coast Fertility Society. Now it's called the Pacific Coast Reproductive Medicine Society. At the very beginning, they only allow physicians to come to the society. In fact, Richard Mars helped me to write a letter to them and ask them to kind of admit me to be one of the members. And actually, that was the watershed moment. That's when they actually let go of that strict requirement. And so I became a member of that society and continue onward to join the American Society of Reproductive Medicine. So I think it's the pushback is not really the patients, and understandable. Physicians don't really understand Chinese medicine that well, so it takes them a little time to get themselves acquainted and understand how this medicine works. And so our job, as you know, through the years is not just working with our patients. A lot of times it's the physicians also. They need to be educated. And a lot of times when they're going through IVF, they don't necessarily know what acupuncture does. They don't necessarily know what cupping does. And even more importantly, they don't even know what herbs do. So a lot of times they have a lot of pushback on, well, let's try not to use herb during IVF, even though you can see an obvious result in what it does in egg retrievals and transfers in the success rates. So a lot of times it's not necessarily the patient, a lot of times also educating the physicians as well.
Right. They helped us because they were benefiting so much from the acupuncture and the herbs and the bedside manner. I think that's another important part that we provide, being the ones who have a little extra time to listen and to provide lifestyle counseling, things like that, the empowerment piece, right?
Yes.
So in providing that, then their outcomes are improving, and the physicians started to make the connection and to see this through patient feedback, I'm sure.
Yes.
Yeah. Well, I'm so grateful that you and your dad and your brother opened Yosan University, the school where I began in 1996. And it was funny because one day...
Well, it's been a while.
Yeah, right.
Yes.
A long time.
I still remember it was just yesterday.
I know. Yeah. Well, I remember we were in a class together. You had to get continuing education units, and you came to the facial diagnosis class, and we were partners. And I made some comment like, I feel like I've done this before. Because you were saying something like, are you anxious about the exam or something? And I said, I feel like I've done this before, which is a whole other episode, like past life things. But I do feel like this medicine really is a calling, but specific to fertility, reproductive medicine, the counseling, the understanding of what's happening in Western medicine and in the person's psyche, her spirit, her emotional body, and what we can do with respect to herbs and all of that. So this idea of holistic is really what the Baby Makers is about. I want to provide these conversations so that things like acupuncture and energy and herbal medicine is even more demystified, so that the patients start thinking for themselves, I need some of this or that or whatever. So with respect to energy, the energy of fertility, you have a book called The Tao of Fertility. And I think that that was another great way of letting female patients in particular to know, hey, there's these meridians and this is what's going on with the acupuncture. This is how it's working. Could you say something about the Tao of Fertility?
Sure. So I wrote a book. I realized there's a lot of education need to be done in the early days. And a lot of people don't understand how acupuncture or even the modality of Chinese medicine works. So I wrote a book to try to educate my patients. And in some ways, this is a book actually is written by my patients. I am there as a conduit. They are the one that actually helped me to create this book. So to start with, we interview many patients. And really what I wanted to do is I don't want this book just be a voice of me. I want the book to be a voice of everyone, because it takes a village to actually have a baby, even though some people have it easy, but a lot of patients it's very, very challenging. So I decided that a lot of people who have a lot of experience going through this medicine needs to reflect on what is their feeling and what's their results and what kind of challenge they go through as they go through not just this medicine, but go through trying to get pregnant. So I basically integrated some of these voices into our book, into the book. But I speak about the meridian. I talk about the herbs, which herb can be useful, the diet, more important, lifestyle. Looking at the lifestyle, a lot of people don't sleep very well or have a lot of stress in their life. And so, and as you know, trying to get pregnant by itself, infertility itself, it's a stressful situation regardless, and sometimes can be one of the most stressful situation. So a lot of time is learning how to walk through this, how to travel through this journey, and at the same time get to a sense of equilibrium, or get to a sense of, even though you never really reach that balanced state, but get a sense is that you have a little bit of control, that you can actually kind of relax and go through this journey with somebody on your side. The book with many voices is a form of that support. And so as when we see patients, I am their support, but a lot of time they need that also at home. So that's the purpose of a book, also to help them throughout this journey.
Mm-hmm. It was good for the practitioners too. I was like, Dao's top favorite reproductive herbs?
Yes.
I want to know those.
Yes, thank you.
Yeah, it's funny. I want to segue here. Having been a patient of yours for fertility, remember, I was 31 years old. I had recently graduated and my FSH was 21 points. And I was like, I'm one of his students. Could I please get moved up on the wait list to get an appointment? But anyway, I did get in to see you, and you said something that changed the course of my fertility destiny. So I need to say it here. Because I had that diagnosis of early menopause. You said, Danica, if your body is programmed to do an early menopause, then it's going to. Stressing out about it is going to take it there even faster. So I took that and moved it in the opposite direction and thought, well, then I can slow it down. If I can speed it up, then doesn't it stand to reason I can slow it down? So I started more acupuncture, more qigong, more healthy eating, and better sleeping, all of that. But just to your point, to like seize some extent of imagined control, to believe that. And then in class, you had taught us that this kind of practice, Chinese medicine, but specifically fertility, interacting with the patient is a negotiation, right? And I think that part of the negotiation is where we trigger them. Sometimes we listen and we validate. That's a lot of it. But we also have cultivated a keen intuition, a sense of things, especially when we've seen as many patients as we have. We do have a sense of how it's probably going to play out or something. And to trigger the patient to make a decision that's going to be in her best interest, I think that that's just as rewarding as when it works and they have a baby. My all-time goal, or the thing I like best, is to watch them be transformed in the process to somebody who is so afraid, to somebody who is more courageous and empowered, right?
Yes, yes.
But the triggering comments to the patients is a nuanced skill, right? So I think it's funny because patients will tell me, and I'm sure that it's impossible to know what it is when you're dropping a pearl of wisdom, right? Anything you want to say or add to that?
Well, I'm actually very honored to help you. And as you know, there are a lot of patients you and I see that have premature menopause or going toward that journey. And I think what you say is correct. Yes, you can help it. You cannot help it in the sense is that you are scared and it makes you even more anxious. So knowing, sometimes this is a situation, sometimes knowing the diagnosis may not be necessarily good for you. It makes you actually even more scared.
For sure.
So when you talk about negotiation, it's not negotiating with the patients in the sense of physical being, is actually negotiating with their energy, negotiating with their spirit. As in some ways, the spirit is restless and the spirit is really cannot see the opening. You are in the midst of the forest, there's so many trees, you just can't see where you're going. And so a lot of times you as a physician, as a healer, you have the 30,000 feet kind of view. You can see where the patient's going, and we have to actually nudge the spirit to go on that path. And that is, that's just what I want to say. That's actually, you talk about pearls wisdom, sometimes it comes out when it's needed. I don't think you and I are trying.
Right.
It just happens when you know that is necessary, when it's needed. I think part of that is really comes from our wanting to care, our wanting to help,
because we really do care already. We're empaths.
Wow.
It's hard. We wish we could care a little less sometimes.
Well, there's ways that you can kind of put some boundary to it so that your personal life don't always get consumed by it. Yes.
Right. Well, back to this idea of triggering comments, right? So, or helping to guide the patient. So one day I came in for treatment and I was particularly charged, and you were running late, and I grabbed a box of tissues and I was crying. I was sobbing, and there was a stack. There were like 13 tissues in a pile. I don't know if you remember this, but you walked in and you said, "Danica, you started without me." And I have to say that really diffused some of the grief that was spiraling in that moment. So it's like the right thing said at the right time, but it is a dance of energy. It's an interaction. I had a patient in here this morning who is very, very anxious about money and having enough money. And she recently had her third miscarriage. And so the kidneys are weakened. And so I said, "Do you know what emotion is associated with the kidneys?" It's fear. But do you know another emotion that's associated with the kidneys that I think will help you more than fear? It's wisdom. Let's look at what you can change and what you have learned and where you can maybe stop saying there's not enough and to reprogram in your mind that there's more than enough resources. Like those kinds of things, they are subtle, but they're really important. And then you hope that the patient runs with it to strengthen her energy.
Yes.
Right?
Yeah.
So when you told me that stress was going to move me faster to menopause, that definitely got my attention at 31 years old. And because I already had my clinic and I had my herbal pharmacy, I took myself to my colleague, Anna, and it was empowering for me to have the awareness that what I need, I already have. It's like, it's accessible to me every single day if I wanted to have acupuncture or, so that was very empowering. And I don't think that the patients can, they don't have that, but they don't necessarily need that. What I needed, I got, and that was to have a challenging fertility case that I worked through myself, and I learned so much in the process. And then I can share that with the patients. And it's believable and it's personal, and they like that, Yes. And so, so that moment, your comment was very, very pivotal, as was the MD's comments that I would never be a candidate for in vitro. So another pivotal moment on my path was when the fertility doctors told me that I wouldn't be a candidate for in vitro. And a little voice said, well, you're not going to do in vitro. You're going to have a unique path and it's going to be inspiring. And then I chose to believe that, you know.
Yes.
I felt like my personal journey kind of merged Western medicine through the treatment of endometriosis, which I'd really like to discuss that with you, as we just wrapped up Endometriosis Awareness Month, and that's a strong suit for you with respect to herbs and acupuncture. And I've done the surgery a few times. So I'm obviously someone who benefited from having endometriosis excision surgery.
Yes. Yes.
But following the pandemic and exposure to COVID antibodies, an illness that causes blood clots, I think that the conversation about endo is getting louder, and I'd love to hear your thoughts on that.
How much time do you have?
Right.
It's going to depend on how much time you have.
Right.
But the ideal situation, if there's such thing, I'm going to go back to basically the time of menarche. Because if you are going to really deal with the endo situation in a much more comprehensive and more effective way, would be starting when they're young. Because as you know, the damage and the worst damage is done when you're young. And so in China, when someone who have dysmenorrhea, painful periods, and I'm not talking about just having some mild abdominal cramp here. I'm talking about for adults, carrying a child, 14-year-old, to the clinic, yelling and screaming. And that is actually how we deal with it in China. And in fact, that was my residency. So in the sense is that Chinese don't believe in taking painkillers. We believe in, hey, if there's a pain, something's wrong. We are not going to mask the pain. Let's see what we can do to deal with it. Yes, we can probably take painkiller to shut down the pain. But more importantly, why? Why do we have such pain? Why do we have so strong? Now, I'm not saying every endo patient have pain, but a lot of endo patients do have pain. And that is the number one first sign that you can actually work with. And so right off the bat, 1/3 of patients who have endo who has a lot of cramp, at least, those are the patients you can manage right off the bat from the very beginning. So if the pain is so strong, yes, you might have to use birth control pill. You might have to use continuous birth control pill. But it doesn't necessarily mean that the condition's gone away. It does mean that you have to address it. It does mean that you have to treat it. It's a very strong inflammatory activity in the body that our body is somehow rebellion and going against its own energy, going against itself. So that's the time where you really want to work on it. So that's the ideal situation. Now, you and I don't live in an ideal world.
Luckily, my 16-year-old daughter
yes.
is living there and not struggling with a lot of pain, but I definitely did.
Yes. And, in this country, when people have a lot of pain, especially at that age, you know what we do here. Get on birth control pill, take painkiller. Okay. So is that a good thing? Absolutely, in the sense to manage the pain. Is that a good thing for the disease? No. Because you're just kicking the can down the road, and now you're going to go through years of eroding situation where the inflammation keep on battering the ovaries, the uterus, and all the other areas in the pelvis that can create a lot more problem, specifically infertility in much later life. So you and I don't always get into the ideal situation. So we take patients as it is when they come. A lot of time they're early 30s or late 30s where that they've been having these painful periods for such a long time. And some of these patients are definitely in those situations. And as you know, you can see in their blood tests or their ultrasounds or even their IVF or insemination stimulations, they're suboptimal. They're not doing very well at all. And they don't really have history of anorexia or anemia or any other problems that to really denote or to point toward that situation. So what you're seeing is that you're looking at the very strong possibility that there may be speculated endo that may be creating problem. So we deal with these a lot of times afterwards, in the senses they're already having some damage. What do we do at this point to trying to revive, resuscitate, or strengthen the ovary to trying to have a better odds, better egg development, better follicular genesis? So that's where that I spend, and you and I, we know that we spend a lot of time looking at ways on how we can improve the quantity and the quality of the eggs, as well as the whole implantation uterine environment. So we're dealing with endo, we're dealing with adenomyosis, and these are the things that I think we need to keep an eye on these, keep an open mind. Sometimes it's very easy to say, oh, your cramp is not that bad. It's true. Sometimes the cramp is not that bad. And so it's very easy to dismiss in some way that, hey, I don't think you have endo because your pain is not that bad. So I think it's even for healer, even for us, we can get fooled by it. So sometimes, patient goes in and all of a sudden you're finding stage 3 endo, where there's a lot of migration of endometrial tissues in the pelvic cavity, but their symptoms are mild, but the damage is done. So a lot of times we have to be open-minded to understand this disease is stealthy. Mm-hmm. That's the word I'm going to use, a little stealthy.
That's a great word. Mm-hmm.
Yeah. Mm-hmm.
Yeah. And then there's the challenge that we have as a practitioner with fertility patients. They don't want to hear the thought that they might need laparoscopy because it equals in their mind a delay. Mm-hmm. But to sometimes, we try what we can with acupuncture and herbs. And in my case, I had managed to get the pain down from a 10 to a 2. I wasn't in pain anymore. But I knew that I had those adhesions, and I knew that there was not, that it wasn't a good environment. Mm-hmm. So I had to negotiate with the surgeon to have that first surgery. But I had the luxury of not being in a relationship and the time to heal, such that 2.5 years after having the surgery, I conceived Kira with one attempt only, natural. So the patients that are doing in vitro, if we suggest, like, we've managed your pain and now your periods are coming at a regular frequency and the flow is looking more red, less purple, less brown, all of the outward signs, and the mood is stabilized. Like, all of these outward signs are there. But like you said, the stealthy condition of endo is still there. And like, sometimes the doctors will do a receptiva, uterine biopsy to find out if there's BCL6, but those patients, they really don't want to hear that they need to look into that inflammation, because unexplained infertility is the problem, and loss. So how do you negotiate with your patients in this conversation?
I think my experience is probably a little bit more different than yours, in the sense that the places where we are more challenged is maybe our advice come a little bit too late, or that we don't have enough symptoms to tell us that we need to refer them out for laparoscopy. Mm-hmm. So a lot of times it's more that, as you know, one of the things we try not to do is trying to burden our patients with surgery. That is not something we try to do. Mm-hmm. But realities, some of these patients do need surgery. But then you look back, you look on the other side, you never can really answer the question whether or not, when this patient goes through surgery, whether or not it's actually going to be successful. And what I mean by successful, yes, you're going to remove endometrial implants, and that's going to be very successful. In that sense, it's a reduction of these inflammatory tissues, but you don't know whether or not that's going to revive their ovaries.
Mm-hmm.
Okay, that is still shot in the dark.
Or treat adenomyosis in the cavity, right?
Yeah. I think in those situations, age plays a role.
Mm-hmm.
I think that if there's an endo and if you have a surgery, a younger woman who does that surgery, probably the outcome is going to be better than if it's older woman. And the reason being is very simple. Your ovaries are more, the revival is much better when you're younger. Okay. So I think there is a sweet age, there's a place where that there's much more opportunity when you're younger.
Mm-hmm.
Yeah.
Yeah. My patients, they're hoping that I will tell them they don't need to do that surgery or whatever, like that we can fix it with herbs and emotional conversation. But it is, it's such a complicated decision to make, and it's a gamble.
Yeah.
So
it's complicated for even the best physicians. And I can tell you that because it is many times over and over, I see how when my patient sees different physicians, they have different opinions. Some wants to do laparoscopy right away. Some wants to do the stimulation first before they do laparoscopy. So there is quite a bit of differences among even physicians themselves. So it's difficult.
Yeah.
It's challenging.
Yeah. I think it was made more challenging in the last few years with COVID antibodies in the bloodstream. Do you agree?
That creates a different ball of wax, so to speak. I think the COVID infections, one of the things that I see that was painful to see is that I have 2 or 3 miscarriages due to COVID infection, while some of my patients are pregnant and they contracted COVID and they had a miscarriage. We don't really know whether or not they are going to actually miscarry, but it's associated with it. So I can see in that light, I can see that as a big influence. The other influence I've seen, some people after their COVID, their ovary just don't function as well. So in some ways, they're not stimulating as well. Their hormone profile is weaker. We do see that. We do see that. At this moment in time, where this is 2024, COVID influence is no longer as great. The disease itself is no longer as great. So I'm not seeing as much a problem now during this period.
True. Because I see so many endometriosis patients, and that's blood stasis, I think of the microclots that are created through COVID antibodies. And given that the ovaries have those microvessels surrounding them, as do the testicles, and the uterine lining is full of those microcapillaries. So what is one of our claims to fame in acupuncture and herbs is the moving the blood.
Yeah.
Right? So are you seeing that you're throwing in more blood-moving herbs to your fertility formulas?
Well, there are treatments that deal with, as you know, activating blood, resolving stagnation. There's 2 parts to it. There is the blood activating, which improves all the blood flow functions. And then there is the stagnation dissolving part of it, which is really getting rid of clots, getting rid of any kind of implants. So I think in endometriosis situation, we know that淤血or stagnant blood is one of the major. Even though it's a secondary pathology, it becomes a primary pathology for endometriosis. So we see that as a treatment. In the COVID situation, yes, there are some cases where you actually have to use a little bit blood, a little bit more, or a little bit of blood activating herbs to really revive some of the circulatory issues that relates with COVID. Yes, we do see that. Not anymore now, but yes, in I think in the alpha and delta time. I think it's 2020, 2021, even 22. But I don't think I see as much in 23. And now, of course, 24, I'm not seeing
even
it.
fewer. Same. It's good. But I found it from an objective standpoint, this was a very interesting time to be a Chinese herbalist, to be able to use our pharmacies and all the different tools that we have for that particular illness, and to use those blood activating herbs more than we had ever used, at least in my time of practice. So anyway, that was interesting, though I wouldn't ever want that again.
Yes.
I wanted to pick your brain about male factor, as you and Dr. Mars were talking at the gala about some research that you guys had wanted to do back in the day.
Yes.
For men.
Yeah, that was very interesting. And we sat down, we say, we could do a very good research for the men. We have all the criteria spelled out. We even have randomized study all spelled out. We could really do this. And because, they can be their own randomizing. And so we have a group, we designed a study and got it all ready. And we have all the herbs ready to go. And very hard to recruit patients. Men just not as open to want to treat their sperm issue as much at that time. So it was very, very difficult to recruit them.
Was it going to be specifically herbal treatment or herbs and acupuncture?
Yeah, it was supposed to be herbal treatments for oligospermia patients.
So for men that don't have very many sperm, so sperm count was low.
Yeah, sperm count. Well, as you know, when their sperm count is low, their sperm mortality is pretty much poor as well, so is morphology. So yes, we identify using the sperm count as the first measurement.
What a shame that they weren't there. But male factor now, if you were to do something like that, you would probably have definitely a higher amount of recruits for that, because now they are taking male vitamins and various different things. So anything else you would like to say besides the one thing that they are told not to do, right? To avoid marijuana, propecia, and hot tubs. What would be some advice for male factor?
I actually think you hit on the nail on the head. I think the use of marijuana and smoking is probably the number one thing that you really don't want to do. Is something that is really detrimental to the sperm issue. So the other things are alcohol, of course, hot tub, hot bath, dehydration. It's also very important that they drink enough fluid. And what I found a biggest issue for some of my male factor patients are basically people who sits a lot in their job. They might be someone who's a video editor, for example, somebody who just a therapist, psychotherapist who are male, sits for a long period of time. And when you sit for a long period of time, it's like the blood just pours, as you know, in the testicle area. It just creates a very nice natural heat sink. And so that is going to, and all you need is maybe just a half degree higher of temperature to make those sperm production very malaised. And so what happens is then you start to have reduced mortality, reduced count, and starting to all sorts of a production issue. And so besides what you were talking about, I also want them to do exercise. I also want them to wear thinner and looser pants. I don't want them to wear jeans as much. I want them to wear more breathable slacks, thinner fabrics, looser, no tights, looser clothes and looser underwear, not flannel underwear, but looser underwears. And also in food-wise, I like them to also avoid spicy foods. A lot of time that raises some of the temperatures. A lot of them love spicy foods. So we temporarily tell them to reduce some of the spicy foods.
Mm-hmm. Yeah. So heat.
Yes. There's a reason why these testicles are hung outside your body. There's a very good reason.
Yeah, exactly.
It's actually reverse is true. Ovary like heat. So ovary is in the depth of your pelvis. Mm-hmm. So it's like totally, in some ways, a little bit of opposites.
Mm-hmm. Unless you have endometriosis and you're creating heat, right?
That's a different situation.
Yeah, it's such a fascinating thing. And I feel like the acupuncturists are pretty fertile lot because we have learned these things and been practicing and educating and informing. But the more that we spread what we just kind of take for granted as common sense, the more we spread the reasoning of why these things are true. Like for the women to not walk around without shoes or socks, right? Because those channels go up to the womb and we don't want cold draft. All of that lifestyle stuff is important. Dao, we're seen as last resort practitioners sometimes. And as you said, if we can get them when they're younger, we can really make an impact. I will never forget that story that your patient who had like only one ovary, and she had surgery, and she just had like a fraction of the ovary left.
Oh, yes.
You remember that famous story?
Yeah.
Can you share that? I think it really speaks to we are last resort practitioners and we help the patients create their miracles.
Yeah. I think she's about 27, 28 years old. She came and see me one day, and she's in menopausal mode, and she's been menopause for 1 year, and she was on hormone replacement therapy. The unfortunate thing is the hormone replacement therapy wasn't really helping that as much. She's still having a lot of hot flashes and night sweats. And so it was a very, very difficult time for her. She's somebody with her history. She's somebody with PCOS, polycystic ovarian disease. And so a lot of times when she have painful periods or painful cystic situation, the surgeon would do some surgery. So through time, multiple surgeries later, one ovary got removed and the other ovary basically chopped up pretty much. So there was not very much ovary left, if there's any. And so when she come to see me, she basically is menopause, and she really wants to, first of all, get rid of the hot flashes and night sweats. She just is miserable. Anybody who have hot flashes and night sweats can tell you that it's miserable. So that's the first thing that she would like to accomplish. But she also wants to know if there's any way to bring her period back and bring her ovulation back. I say, I don't really know, because I don't know how much ovarian tissue you have in there. I don't even know how responsive that you would be. But there's one thing I do know. If you don't try, you wouldn't know. And also that you are on hormone replacement therapy, that actually is going to suppress your own natural functioning. So you're going to have to come off the HRT. It's not even helping you that much anyway. Why don't we get off it? Give me a good 6 months of time. Let me see if I can reverse this trend. So I work with her, and actually did not take that long. I think probably about 2 months or 1 month and a half into our treatment, she started having vaginal discharge. First of all, her hot flash and night sweat went away probably after about 2 to 3 weeks, as we start treating her twice a week. And then the vaginal discharge came, and a little twinging, and she's like, wow, I think I'm ovulating. I say, well, go and have intercourse. Do it. So, and then the next thing we know is she's pregnant. And it was a wonderful experience. And through her pregnancy, everything was really wonderful. But she had some complication later on when she delivered. I wasn't there to help her. I didn't see her for a while. And she came back to see me. She was a beautiful girl. And then she said she had a C-section. And the doctor who did a C-section came back in and asked her, I don't know how you conceived, but I cannot find your ovaries. In C-section, they have to check everything. I cannot find your ovaries. How did you get pregnant? And so that was the history of this particular patient. She's a wonderful patient, and once she has a child, she wants a second one. So when she came back, asked for see if I can help her with the second. Well, obviously she's still menopause at this point. I smile. I say, I don't know if we can do miracle twice. But I'm willing to try. Let's work on it for about a month or two. And if you don't have any ovulation, I think that means your ovaries are done. And of course, it did not happen for her the second time around. But it was a miracle. It's truly a miracle. I think in this situation, anybody can tell you that's really one in a million situation. And I'm just fortunate to be there, to be able to help her, to have that opportunity.
Mm-hmm.
Yeah.
Right. It was funny.
We are blessed.
Right. Yeah. But it was funny because you very humbly made the joke. You were like, yes, I got lucky that day.
Yes. We could always use that luck.
I know. Yeah, no kidding.
Yes.
There's so much to be said for the combined efforts of the patient, the practitioner, the medicine, the science, the herbs, the energy. And I think it's just, I wouldn't be able to think of any other career I would want to have. It's so rewarding, so challenging. For somebody who likes to think a lot, it's fun to be able to think, what is missing here? What needs to shift here? And then to get the patients to be thinking like that too, right?
Yes, absolutely. And the big point these days is very important that we have to put our patient first. And we need to really examine our goal. Our goal is to achieve a family building options, to achieve family building with the minimal amount of harm to our patient. And the minimum amount of harm to also financially also as well. It's not just, you don't want to at the end of the day have a baby and you're completely destroyed in your finances. You don't want to be completely destroyed in the sense of your energy, and it's almost anticlimactic. And so in some ways, we have to take into consideration what are we trying to achieve. At the end of the day, we want to have a healthy baby. At the end of the day, we want to have a healthy patient, healthy family. And that's really where I like to accomplish. That's my goal frequently.
Mm-hmm. For me as well, to help them transform to become happier, which then improves their fertility.
Yes.
Right? We have so many different things we could talk about, but for the sake of time, is there anything that you would like to impart on the listeners in terms of baby making and maybe like attitude, mindset?
Absolutely. I always say, if you want to become a mother, it may not be the way that you think or imagine you're going to become a mother, but you will always become a mother. There are many ways to achieve and reach that destination. Maybe you need to do donor egg. Maybe it's a different situation. Maybe you need to do adoption. But ultimately, a motherhood is not something that you cannot achieve. You can achieve. Of course, it requires a certain amount of finances and resources to get that done. But if you do have these resources, I think you can achieve it. There are many ways to become a mother. So I personally, I feel blessed to be this field. I feel blessed that a lot of patients giving me the opportunity to help them. So to me, it's a privilege and honor to be able to help. So thank you so much for this opportunity to be here.
Thank you for coming on. I hope that the listeners' minds and hearts are opening when they listen to any of these podcasts, as each one of them seem to be landing with this idea that anyone who wants to mother, if they can open their heart and mind, they can. If they can be thinking, okay, I will do foster care, or I'll have animals or fostering animals. There's different ways. So thank you, Dao, for driving that idea home. Before we go, I know that there's several listeners that will want to find you. How would they do that?
Well, my private practice is in Santa Monica. And so they can call us. It's a phone number, 310-917-2200. Or they can go on the website. My office is Tao of Wellness, is TaoFwellness.com. And I also teach at Yosan University, and that is yosan.edu. I'm a faculty as well as department chair for the reproductive medicine for the doctorate degree. So, and as well as a trustee. And so they can find me there also as well.
Yeah. We have people who want to be your patient and listeners that want to be students to do this. It is very rewarding work.
We do have a few patients that became students. Yes, we do. It's wonderful, actually. Yeah. Wonderful.
Thank you again, Dao.
Thank you.